This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week I'm coming to you from Kingman Orthopedics and Sports Medicine at KRMC. My guests are Dr. William Hallier, he's an orthopedic surgeon, and Kaylee Herrero, she is a physician assistant here. Welcome.
Thank you.
I haven't caught up with either of you yet, so I apologize. I usually try to get with people as soon as they start, and sometimes they get by me. So let's just start there. Dr. Hallier, you're an orthopedic surgeon. How long have you been with KRMC?
Well, I've been with KRMC going on 14 years now. I retired from the Air Force in 2015, and I started working while I was still in the Air Force doing some part-time weekend trauma call at KRMC since about 2011.
Oh, yeah. They had that with some of your colleagues out there who worked here for a time, right?
And we still do, actually. We have two folks going on 3 soon that are from Nellis Air Force Base in Las Vegas that'll be helping us with the same kind of work.
And our former doc, I think Dr. Cornelson, did he follow that?
No, that was actually Dr. Oldham.
Dr.
Oldham was at Nellis Air Force Base in Las Vegas before as well.
And Kaylee, how long have you been here?
I've been here since 2018. When I graduated PA school, I took a job here and have been here ever since.
Doc, I want to ask, you're well into your career, but what led you to a career in medicine?
It's kind of funny. I mean, I've had an interest in medicine for a long time. My first love was always flying. I started flying when I was very young, and I was a pilot in the Air Force for a very long time, but always had a peripheral interest in medicine. My mom worked in a physiology research lab at the University of California, and we had astronauts there, high-altitude mountain climbers, ultra-marathoners that they were always doing physiologic studies on, and it very much interested me, and it just was always in my background.
That's the overlap with the sports medicine part too, right?
Yes.
And the guys in the military have to perform.
Yep.
Did you end up having to fix up a lot of training injuries and combat injuries?
In fact, those are 2 different things, but our training injuries and our day-to-day overuse injuries in the military population are really a big part of what we did as orthopedic surgeons in the Air Force. And in fact, as any kind of physician in the Air Force or the military in general, that's a big part of their life. Trauma, that's a lot of that when you go overseas. And I've had a couple tours in Afghanistan where I did hundreds and hundreds of surgeries on broken people. Yeah.
Stateside, I've heard stories about jousting. Are you at liberty to discuss jousting?
I don't know anything about jousting.
That's the right answer. Okay, we'll talk about it later.
Sure.
Kaylee, what about you? What led you to a career in medicine?
I grew up here in Kingman and was really involved in the 4-H community. So I actually initially had interests in being a veterinarian and providing medical care to animals, but I soon realized our community needed healthcare professionals. And so I knew pretty early on in my education that I wanted to go into medicine. Orthopedics was just happenstance. I fell into this and have loved it ever since.
Yeah. Do you know most of the folks I speak to here at the hospital, they come from elsewhere? There's a chance for you here to provide some leadership and some mentoring, right?
Definitely. I feel really lucky that I get to work in the same community that I grew up in. It's great. The same doctor that delivered me here decades ago still works here. And so now I get to be a colleague with him, and it's really a full circle thing.
That wouldn't be Dr. Jackson, would it?
I won't out him.
I have joked with Dr. Jackson, who is a longtime friend of the program, that he's delivered half the population of Mojave County.
That's probably
accurate. That's about right, yeah. Kaylee, let's begin with what a physician assistant does. What is your role in the clinic here?
So a physician assistant is a licensed healthcare professional that is able to evaluate, diagnose, and treat patients in multiple medical specialties. We are trained on a medical model and typically utilized in the clinic to evaluate new patients or continue care for existing patients. We also assist in the operating room to facilitate timely and efficient care intraoperatively, and also help in the rehabilitation process and organize patient care with the physician.
My understanding is on surgery days and when things are really rocking and rolling around here, it's the PAs who really help to keep the machine rolling. Is that?
Definitely.
Not asking you to, pat yourself on the back, but
we definitely play a very key role in operational efficiency. We free up the physicians so that they're able to take care of higher levels of patient encounters while we are able to kind of take care of the more bread and butter things. But that's not to say that we're not involved in those higher level of decision makings as well.
Dr. Hallier, you alluded to some of your service and the many surgeries you performed. Do you have any idea how many surgeries you've performed in your career?
Well, since I graduated from residency, I've probably done 5,000 to 7,000. So I had to look that up, figuring how many I do every year and how many I did when I was on active duty. Yeah. And that's probably a decent number, maybe 10,000, including residency, which is 5 years of training in and of itself. So I think that's a fairly reasonable number.
Do you regret not beginning a tally sheet at the beginning?
I actually have a tally sheet, but it's not all in one place. We have records from when we applied for our board certification. We have other ones for annually when we recertify for credentials with the hospital, and they're all kind of disjointed. There's not like a one-stop shopping location for my case list. But if I really wanted to figure out what it was, I could go back and piece those together, but it would be tedious.
Yeah, it would be. And it's only for bragging. It only pays in bragging rights.
Yeah, and I'm not sure that's bragging rights. I mean, there are people who've done 2-3 times that much. I mean, there are surgeons who operate with several physician's assistants who streamline their processes and can definitely do, 20, 30 surgeries a week sometimes. And we don't do that kind of a load here at Kingman. So, and I haven't done that since I left the Air Force. Since I retired, I didn't really want to push myself that hard. I preferred concentrating on quality care on the people that I do see and making myself available to really be present for those people that I have the time to do so for.
This is something I hear about often when I talk with doctors and physician assistants, sometimes on the record, many times off the record. And people say, there's such a model of kind of a medical conveyor belt. Get these patients in, get them out. And you talked about how important it is to give that better care. And what does that look like to you?
Well, I think you hit the nail on the head. I mean, the ability to spend a little bit more time with patients makes a difference. Every patient needs something from me as the surgeon who's evaluating them. Some need very little in terms of, a post-operative visit where everything went really well. They just need a few minutes of reassurance that their wound looks good and that their surgery went very well and what they have to look forward over the coming weeks after a surgery. And there's others who have serious problems that will require quite a bit of care and evaluation and sometimes multiple diagnostic studies to get to the bottom line of, what can we do to make them better? So they need quite a bit more time and attention, and we want to be able to give them that time and attention when it's required. And I like being in a place working here at Kingman where I have the time to do that, and I have the support from my PAs such as Kaylee, and the medical staff here in the clinic are fantastic, as they are in the hospital, of course. But all those people together really make my job easy and pleasant, in that I know that I'm doing my very best for the people that I see.
How many days a week are you in surgery here?
So it depends. I would say 2 to 3 in surgery on the weeks where we're operating. And again, I'm not here full time, so there's weeks where obviously I don't see clinic or operate. But when I'm here, I'm working a full time schedule for the time that I'm here, if that makes any sense. So we have 3 operative days, and we run clinic here every day of the week, all the time.
Kaylee, tell me a little bit about the process. Let's say you have a patient come in who's got a sports injury, kind of busted up a foot. Will that patient come in through referral, or can the patient begin by just calling the clinic here?
It really depends on the patient's insurance and if they have an established primary care. Most of the time, people come to us through a referral, but a lot of insurances do not require a referral for them to see a specialist. If it's an acute injury, people will typically be evaluated at urgent care or the emergency room and be referred to us through that route. If it's more of a chronic injury, they will typically come through their primary care or independently. Once they're referred to us, their medical record or images usually go into review by myself or one of the physicians, and we try to decide, how timely that person needs to be seen based on the severity of that injury. And then that person is evaluated by typically whatever provider has the next available opening. And our current goal is to get all patients evaluated within 3 to 4 weeks of the initial point of contact.
In our hypothetical scenario, let's say this patient is a candidate for surgery. What happens next?
So if the patient is evaluated here in the office, those images and the patient case is evaluated, by whoever sees the patient. If that's not the surgeon, then say it's me or another PA in our practice, we will review that extensively with the surgeon. A lot of times that patient will also see the surgeon the same day if the injury warrants that or if the patient is requesting that. And then they will be directly scheduled with that surgeon for timely care.
Dr. Hallier, for practical purposes and also for insurance purposes, I know that doctors and surgeons in particular are always trying to find the least invasive form of care, in terms of, is this a surgical intervention? Is there something else? Can you talk a little bit about how those decisions get made?
Yeah, I think that's really important. I mean, people, when they have a problem, let's say specifically a complex problem that's chronic, there's a whole lot of things that can be done early that don't require surgery. And sometimes the primary care provider is in that loop and gets them started on a good pathway towards either mitigating whatever symptoms are bothering them or actually making them significantly better or eliminating them entirely. There's also resources on the internet, which people do use, and those help them generate good questions when they come and see us. So a lot of times by the time they come to orthopedic surgery, they've either self-referred because they felt like they've hit a wall in their ability to self-treat or have their primary care provider treat their problem with the simple, early, straightforward approaches. And then we're there for the more advanced things that we can do for people's problems, which would include sometimes injections, sometimes it's specific physical therapy guidance, and then ultimately sometimes it is surgery. And the ability to go through all of those steps and to take a patient through those is a big part of what we do here. And it's a big part of what our PAs do for us as surgeons as well, is to kind of get that whole process started. So that's a big part of what we do.
Do you find yourself, a patient will come in and you find yourself kind of prescribing other modalities? Oh, that tricky wrist is bothering you again, but let's try this before we dig into this.
Absolutely. In fact, that's an important part of what we do. And sometimes, you mentioned we were talking about insurance originally, and sometimes insurance mandates that you have to start with non-operative, non-invasive kind of procedures or processes before we jump right into surgical procedures. But we like to do that anyways. It's the right thing to do. Not everybody needs a surgery. We have a saying in surgery that sometimes I can make you different, not necessarily better. And that's not really the goal. The goal is to make people better. In order to do that, we need to make sure we exhaust the pre-surgical options first and discussing it with the patient too, to make sure they understand that, because some people do come in expecting a surgery immediately, and we're not always going to jump right on that.
That's a very good saying. I can make you different, not necessarily better. I've never heard that. I think you should make some bumper stickers, distribute them to your colleagues. Kaylee, following up on our hypothetical scenario, I'm thinking, okay, this candidate for surgery ended up having surgery. What do the follow-ups and the rehab, what is that step, or what are those steps like?
It really depends. It's a case-by-case basis. But typically in a surgical situation, most patients are going to be following up in our office within 1 to 2 weeks, sometimes getting x-rays, having us evaluate their surgical wounds, making sure things like pain and swelling are under control, and then making sure that the appropriate timeline of rehabilitation is established, and making sure communicating that with our physical therapists that they know what our expectations are in terms of rehab protocols, and also explaining that in detail to the patients.
Mm-hmm. When a patient is a candidate for orthopedic surgery, it's a free market. Patients have a lot of choices on where they can go. KRMC has some advantages. Can we talk about those?
Okay, I'll start. No, I mean, it's a really good question. Like, why would somebody want to come to KRMC? And I think it's really important to discuss that. First of all, obviously the locality. I mean, if you're going to get a surgery for an orthopedic problem, KRMC is pretty much the only option within the city, right? So then you would be looking at outlying communities. So travel distance is important. But also, and it really is, I think that's probably lowest on the list, really. I mean, people do come here from Lake Havasu, they come from Bullhead, some come from Flagstaff even to get surgeries here because of the quality of care. And really, we have a caring operating room staff, and specifically, our anesthesiologists are very well trained. We have diagnostic resources, which are very advanced. In fact, most of our radiology staff is Mayo trained, and they're just incredibly competent, which means we have a higher degree of accuracy in our diagnostic abilities because of that resource that we have. But also just the quality of the surgery. I think, all of our surgeons are board certified, and we have been for quite a long time. In fact, most of our surgeons here have been practicing longer than I have. So I'm kind of the young guy, even though, I'm pushing the upper end of the age range.
We won't talk about
but
that.
The folks that work with me are really, really talented. They have a lot of experience, and they have a lot of experience here as well. So, the ability to take care of Arizonans and those from the tri-state area is really excelled here because of the fact that we've been doing it for so long. I've told patients, and I do not joke about this, if my mother broke her hip in Prescott, I would literally go down there, check her out of the hospital, bring her here, and have one of my partners do her surgery. But that's how confident I am in the care that people get at KRMC, and that's not a joke. I do say that, and I do mean it.
You've worked in surgical capacities in many different places, and so I'm sure you're taking note of what works here and what works there and what doesn't work, and sometimes dysfunctional things I'm sure you saw along the way and bureaucratic lumps in the road. How does all that go into informing the care that you deliver today?
Well, I know the quality of the rehabilitation here. We have our own physical therapy and occupational therapy staff. I do a lot of hand surgery, so I rely on occupational therapists and hand therapists, which is a subset of occupational therapy. So I have that capability here, which is really important to me deciding what level of surgeries that I can do here. The same thing goes with our colleagues who do sports medicine and do joint replacement, of which I do some as well. Our rehabilitation capabilities are really, really important in determining if those are good procedures to have here versus elsewhere. So what happens after surgery is a really important part. Going back to why here, again, I think I've seen people do better here. So I've worked in many different places where I've done surgeries in other hospitals and have seen the post-surgical outcomes, usually based on rehabilitation and sometimes it's environment as well. But I've seen people not do as well in other facilities. And I don't have all the answers as to why that is here, but I do know that it does happen here. Our infection rates are extremely low compared to the rest of Arizona and the rest of the nation, to be quite honest. And I think that speaks for itself.
You perform a range of surgeries. Can you talk a little bit about some of the ones you're doing most often?
Sure, I do some sports medicine, but it's more of a traumatic nature, like when people break their ankles or have high degree sprains in their ankles or wrist injuries from sports, as well as some shoulder stuff. I did a lot of that when I was in the Air Force, obviously, because younger people, more sports medicine type injuries. But since I left the Air Force, I did more trauma, and I did a lot of trauma in the Air Force as well. But since I did that, my role here is primarily trauma call coverage. So I do a lot of trauma, a lot of broken wrists, broken ankles, broken hips, and people fall down or get in car accidents and they break things, and that's what I fix primarily. I also do a lot of hand surgery as well. I'm not board certified in hand surgery specifically, but I trained with one of the leading hand surgeons in the world, really. And, we got signed off to do a lot of really advanced hand stuff. So I do a lot of that anyways. And that's basically where my elective practice has gone.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week I'm coming to you from Kingman Orthopedics and Sports Medicine. My guests are Dr. William Hallier, he's an orthopedic surgeon here, and Kaylee Herrero, she's a physician assistant. Kaylee, I want to return to you for a question about kind of old injury. So let's say you have a patient come in this is not an acute thing, this is an old sports injury, an old war wound, and it's like, hey, I'm showing you my left wrist, by the way. This is a personal story, but no, I've been living with this thing for a while, and day to day I'm okay, but I'm sitting at the computer and my hand goes numb and I just have these problems, but I can live with them. So you know what I'm getting at? At what point do we say, like, okay, look, this is something you live with? And at what point do we say, you're a candidate for surgery. This might make life better?
So our job is to evaluate what kinds of things you've tried and factor that as well as your past medical history, past surgical history, and decide if you are a surgical candidate and if your condition warrants a surgery. As Dr. Hallier already described, a lot of people come to us without having tried any conservative measures. And like we've already said, surgery is typically our last resort. It's the cut that can't be undone. And so I take that seriously, and I want to make sure that we've tried all these conservative things first. So we talk about things like activity modification, dietary and supplement recommendations, exercise recommendations, and then we can even get more aggressive in terms of medication and injections. And once those things have failed, or if the condition is debilitating to the point that it's affecting activities of daily living, and patients are medically stable, and we've worked collaboratively with their primary care physicians, and they've been deemed, surgical candidates, that's typically when we move forward with surgical intervention for those chronic conditions.
I know you see a lot of patients. Do you hear success stories? Does anybody ever just stop in after follow-ups, after all of that? Kaylee, do you hear from people who say, hey, I just want to let you know, a few years ago you did this?
Absolutely. In fact, just this past weekend, I was at a wedding, and one of a patient that I previously treated was out on the dance floor and reminded me that Dr. Hallier had done his hip replacement. So we hear this quite frequently. We get Christmas cards from our patients, and a lot of times we have repeat customers, either for other injuries or bringing their friends or family to us. And I think that's the highest level of flattery that we can get, when people have a good enough outcome that they trust us to take care of their loved ones.
Kingman and Mojave County, they're known as medically underserved areas. This is not news to you. And we often talk on the program about some of the challenges of working in a medically underserved area. There are challenges. However, these are some of the wonderful moments that you may not get if you were practicing in Los Angeles.
It's the best.
In the moment that we have left, did you want to add anything to that?
No, I think that's good. I mean, it's a small community, so I think we end up sometimes inadvertently seeing patients that we've helped years ago. And unfortunately, sometimes you don't put two and two together when you run into a fantastic patient at Walmart, but you don't exactly remember what they did or what you did for them. So that's unfortunate, but many times we do know, and we try to remember. And it's always just wonderful to hear from our patients whenever we have that opportunity. It's a really cool thing to hear that we've done all right.
You have repeat customers like the 40-year-old guy who can't quit skateboarding?
Oh, we do. Yep.
In the moment that we have left, I want to ask, what is ahead for Kingman Orthopedics?
Well, there's a few things. First, right now we are working primarily on a group model where we have several surgeons who take on the primary call and trauma responsibilities at KRMC, and we've just hired 2 new full-time surgeons who will be pretty much looking after the elective practice, where they'll be doing more of our joint replacements, our sports medicine. One is a sports medicine specialist. We're also bringing on a pediatric orthopedic specialist. Will be one of those 2 folks who will do general adult orthopedics, of course, but will still vastly expand our ability to look after growing children with the kinds of things that are more of a chronic nature, such as spinal deformity kind of issues, even infant clubfoot, things like that. We'll be able to bring into our practice, which is not just for Kingman. I think it's the whole tri-state area can benefit from that. We don't have any pediatric orthopedic coverage anywhere, between Havasu, Bullhead, pretty much all Mojave County. That will be a new road, if you will.
We're also looking at implementing a same-day walk-in clinic, as well as an orthopedic urgent care, utilizing our PAs here to help with those more acute injuries, as well as management of the continued chronic injuries as well.
Tell me more about the walk-in clinic and how it works.
So right now we have 3 PAs in our practice, and we take an alternating schedule where each PA is blocked out for a few hours every day to take walk-in patients on a first-come, first-served basis. And if we cannot accommodate in that same day and time frame, then we offer an appointment, hopefully in a reasonable amount of time. And we also have weekend clinics. We've been doing this for years, where we have intermittent Saturday clinics. So that's something we plan to continue doing to continue serving our community.
That's Kaylee Herrero. She's a physician assistant. And Dr. William Hallier. He's an orthopedic surgeon at Kingman Orthopedics and Sports Medicine. Thank you both so much for your time today.
Thank you so much for your time.
Thank you for having us.
For more information on Kingman Orthopedics and Sports Medicine, you can call 928-681-8693. That's 681-8693. And that's the program. That's Focus on Your Health. I'm TG LaFredo. Thank you for listening. Stay healthy, and we'll catch you next time.